I'd like to welcome Dr. Maureen Kohi, who is the Ernest H. Wood Distinguished Professor and Chair in the Department of Radiology at University of North Carolina in Chapel Hill. She's also the course director for the VEINS program at the upcoming VIVA meeting at the Wynn in Las Vegas, November 2nd and November 3rd, 2024. Welcome.
Thank you so much for having me.
So I was looking over the agenda. You have quite a few different topics that are really clinically engaging for a variety of different clinicians. So what's new at the meeting?
Thank you so much. I just want to underscore the incredible work that was put forth by our VEINS Planning Committee and our VIVA board. This is a multi-specialty, multidisciplinary effort in creating the top of the line, best knowledge out there, a combination of didactics and clinical cases meeting. So I'm very excited about that. I think right off the bat, the newest thing that we as a board are very excited about is the Sunday afternoon combined PE summit with VIVA. So VIVA tends to focus more on arterial. It is still a forum to discuss multidisciplinary vascular disease, and there is some venous content, whereas VEINS is exclusively venous disease. But we felt that it was really a great opportunity to just bring both together. And it's really just a wonderful joy to work with my dear friend and colleague, Dr. Sahar Sabri, who is the course director for the VIVA meeting. And so we've put together, again, a multidisciplinary, very collaborative summit discussing the many new trials, the new devices, new debates as it applies to PE. So you'll see that in the afternoon of our Sunday. New content will also be throughout VIVA as it applies to pelvic venous disease. This is a great opportunity to showcase the Embolize randomized controlled trial comparing ovarian vein embolization compared to placebo for the treatment of pelvic venous disease. This clinical trial is co-led by doctors Ron Winokur at Cornell and Gloria Salazar at the University of North Carolina. So there's going to be great buzz around that because VIVA, in addition to SIR Foundation, are sponsoring the clinical trial with the support of Penumbra. So I'm really excited about that. As always, we're going to have our Sunday morning blue sky session, which is so great. This is where we're going to have showcasing of the best and brightest yet to come from our industry colleagues in terms of new devices and new thought on the stage. So that's the blue sky breakfast. And then as always, I'm always excited about the abstract session, which it demonstrates first in human trials, first data being dropped at the VEINS with respect to venous clinical trials. And then lastly, I'm so excited about Dr. Kathy Gibson receiving the VEINS Award, and that will happen on Saturday, November 2nd.
That sounds really, really great. I love the diversity of the different topics, but I also like the multidisciplinary aspects. When you look at the program, you can see that there who's who giving the talk across disciplines. And I actually think that's key because when that happens, we actually learn from each other because we all take different points of view from the same problem. A case presentation, for example. And I think when we bring together all our different expertise, we actually benefit our patients. And obviously education, I think, is better when we break down the barriers between the silos in the disciplines, which are all too common, unfortunately. So
Exactly.
who should be attending these meetings?
I think anyone who has any form of interaction with patients with venous disease or vascular disease, we have a curriculum set for, we have a curriculum set for trainees, so either fellows in vascular surgery, interventional cardiology, or interventional radiology residents can apply to come, and they are going to experience these lectures. In addition, be able to do case competitions, etc. We have a parallel conference going on with other clinicians. So these are our APPs, etc. And then across the gamut, anybody who is either from vascular medicine, interventional cardiology, interventional radiology, vascular surgery, or just anyone, podiatry, anyone who's interested in learning what is the latest and greatest in the treatment of patients with vascular disease should come to VANES and also the VIVA meeting. And why wouldn't you want to come to Las Vegas? I mean, let's just also, this meeting, the VANES meeting, happens immediately after Halloween. So it was a great opportunity to just take a couple of days off and come to Las Vegas for Halloween, which I assure you is a once in a lifetime experience.
Looking forward to the meeting. Thank you so much for telling us a little bit about it. It sounds really exciting. Looking forward to it. Thank you.
Thank you.